Hi guys, hey, it's Dr. Baker here. Hey, I am in a airport in Panama City, Panama. I just wanted to share a little insight into a study that just was published looking at the effects of the class of drugs, which Ozempic is in, semaglutide, and its effect was seen in animal and human cells with regard to cardiac muscle. And what it showed was a reduction in the amount of cardiac muscle that occurred when these animals were subjected to this. And so that's obviously a negative thing. You know, it's like when you have a heart attack, you lose cardiac muscle, cardiac muscle dies. And so theoretically, this could have a similar effect. Now, how it affects human beings in vivo is not yet known. We might have some data in a few years that we see perhaps reduced cardiac capacity down the road on patients on these drugs. It's too early to say. I don't know if this study's been done, but it's just something to be mindful of. I mean, this, again, you can't necessarily extrapolate animal studies to humans or, in vitro, human cell studies to full living humans, but it's something to just keep an eye on. So again, as we know, the known side effects are becoming longer and longer, and certainly the GI side effects with the nausea, vomiting, the gastroparesis, the concerns around pancreatitis, perhaps thyroid cancer, suicidality, weight gain upon discontinuation, the possible fat cell hyperplasia that occurs. And so just remember, there's no shortcuts, there's no free lunches. If it seems too good to be true, it usually is. And what you can be almost assured of any promises that any drug manufacturer makes over time, those promises will often be found to be not founded in reality. The side effects are often diminished, the benefits are often over promoted, and this is what we see over and over again. So don't be surprised that you'll see some people that will have significant harms from these medications. There are, in my view, better ways to tackle these problems than just throwing drugs at it. So anyway, that's my thoughts.